And we're live.
All right, good morning. This is Senate Health and Welfare. It is Friday, the last day of January, believe it or not. Amazing. And the days are getting longer, which is also good. So this morning, we're going to go through and look at some of the bills that we have in committee. And we are welcoming Senator Byhowski to come up and talk with us about her bill S1. Pretty cool. That's the fun you get to do S1.
Yeah.
Good.
For the record, Senator Tanya Vyhovsky, and I am the sponsor of S1. As many members of the committee probably know, back in 2011, Vermont passed Act 48, standing up healthcare as a public good. But we have not yet realized that. And S1 is a proposal for a path forward to realizing healthcare as a public good. What it proposes is over the course of time using aid bands to bring people into a children's Medicaid or Dr. Dinosaur-like program. And I chose that because it is the most comprehensive of our healthcare programs that are run at the state level. It would, in its initial phase, bring in everyone under the age of 25 and everyone 55 to Medicare age, and then over the course of time would come to meet in the middle until everyone was covered. And that is the short version of what the bill does. There's also a lot of studies in the bill and waivers to seek from the federal government. And while I certainly recognize that those waivers might be challenging to get at this point in time, I think there might be other pathways for us to consider in standing something like this up, which is why it does state a Medicaid equivalent program. We did this actually to cover some of our migrant workers. Creating a program that had all of the same benefits but didn't use the federal funding would be one mechanism to utilize if we were unable to access the federal waivers to do some of this work. So that is high level, why and what, and I'm happy to answer any questions.
Just a quick question. Have you considered the funding piece for this? Obviously, there's some different funding resources needed, or are you relying on the match that we might get through a waiver?
Well, and so some of that is what is in the bill is to consider the different options. You know, I think the match would certainly be the most favorable, but I also think given that many Vermonters are paying 10, 15, sometimes 20% of their incomes towards healthcare, we could also look at what a potential payroll tax might be and see if that would be less than largely what people are paying now. So in the bill, there are some suggestions to explore what the different funding options would be. And I certainly know, you know, when a similar idea was explored quite a while ago, I think Peter Sterling put forward a similar idea. And the cost was viewed at the time to be too high. But I would say that given that in just the last 5 years, our out-of-pocket insurance costs have more than doubled, it's really time for us to consider what the cost of doing nothing is.
Yeah, thank you. And then I think Act 27 working group also considered this again. So it's been on the table for a while, and it is something for us to think about. And we will, and FYI for you, we are going to have a committee bill in here, hopefully to take the cost of healthcare down a notch. We'll see what happens. Oh, but this is something to consider. Thanks. Appreciate it. Appreciate your time. Questions for Senator Byhowsky? Good.
Wonderful. Well, thank you so much. Oh, Senator Hart, did you have a question?
No, I don't think I have anything.
Oh, okay. I didn't want to interrupt you.
No, we're good. We might.
I work with you quite often. I know better.
Yeah, we'll listen to Jen a little bit and then go through the bill more specifically. And then we'll make our decision about what we can handle. And we have 2 years of the biennium. Remember that.
I do remember that. And
Okay.
certainly have a couple of other suggestions coming your way for ways that we might
Don't
tackle
worry, we'll
these
get there.
healthcare issues.
Good. Thank you. I know you're very interested in this.
Yes, I cut my teeth on that healthcare as a human rights campaign as a little baby organizer, so it is definitely an interest of mine.
Well, you'll be happy to know that the term public good was placed into that bill
I know.
by yours truly.
Well, thank you for doing that.
Yeah.
And I think that we can work together to hopefully get there sometime soon.
All right. Well, good. All right. All right. So we will move on. Is Senator Hardy, what time is she scheduled for?
9:10.
9:10, she should be here.
We're 1 minute. Chris.
1 minute.
Do you want me to scoot and get hard copies of these bills? For some folks?
No, Kiki can do that.
Okay.
Do you want a hard copy of the